It's very hard to watch the person that you love, sorry, be faced with such adversity. And it's as though your whole world just starts to crumble. And you get through one amputation, which Dick did very successfully. And all of a sudden we were faced several years later with a major amputation of Dick's toes and then a below-the-knee amputation. And Dick recovered extremely well from that, and you're thinking, okay, life is moving on and back to normal. When a little time period after that, Dick started to have problems with the tips of his fingers. And he was then told he was going to need amputation of those fingers. And realized this is somebody who loved playing the piano, who loved playing the guitar. He was a great tennis player, skier, but due to all of this, he was no longer able to use his hands. It was very painful. They couldn't get the wounds to heal. And so no longer were you playing the piano or the guitar or do the amputation, skiing, playing golf. It was too painful. And you somehow have to find the strength to pick up the pieces and find other things in your life that are going to make you happy. When we first heard about Aastrom and what they were doing and taking bone marrow and stem cells, of which they were going to then make up a product to put back into my husband's hands, it almost sounds like something, wow, this is incredible. Who has heard of this going on?
My lifestyle's always been very, very active. I've played a lot of tennis, a lot of golf, hiking, just all sorts of things. And about 10 or 12 years ago, my blood circulation really was getting very, very poor, to the point that I could not keep a decent blood flow to my fingertips. Not enough oxygen, not enough blood to support the tissues, and my tips of my fingers literally started to just die off, and we had to do some amputations on the tips. That would not heal up, and that repeated itself, and it was just an ongoing problem. One of the biggest things was pain. Just excruciating pain. If you can imagine starting to just have your fingers start to die off, and I was on a lot of medication, made me very, very tired, drowsy. I'd fall asleep, very hard to work. Pain was very intense. If I just touched my finger or just tapped it lightly on anything, it was excruciating pain. So I really had very little in the way of a lifestyle or things I could do. I had to be extremely cautious. If you think about it, if your fingertips in that sort of condition, trying to just button up your shirt or tie your shoe, any of the basic things we take for granted, become just impossible or are very difficult at best.
Mr. Hough is a long-standing diabetic. So he's had diabetes over 45 years. And he had progressive atherosclerotic disease. Diabetes accelerates atherosclerosis. To his credit, he controlled many of the risk factors, but he couldn't eliminate diabetes. And what happened was the main arteries from his elbow to his wrist and then beyond the wrist were progressively diseased, such that there was very little circulation getting to his wrist, and that all of the named arteries at the wrist were occluded. So he had medium-sized vessel disease and small vessel occlusive disease. He had minimal pulsatile perfusion getting into his hands, and as a result they were very ischemic, poor circulation. There almost is no worse pain than the pain of severe critical ischemia. And his tissues were threatened, and then actually the tissues began to die, which means he was developing gangrene of his fingertips, And then as the gangrene developed, he had operations to remove the gangrene, and then additional gangrene formed. And then with the dead tissue, wounds do not heal, and then they become infected. And when wounds become infected, there's additional dead tissue. So it's a vicious cycle. Traditional treatment options are to do bypass around an obstruction, but you need to have an open blood vessel to bypass into, and he did not. The prospect of treating him with therapeutic angiogenesis was very attractive. Well, I think the future is very bright. We are working with Aastrom, evaluating the use of bone marrow stem cells in patients with critical ischemia. The work being done at Aastrom is a sign that regenerative medicine is a very bright spot in our future. It's going to help an enormous number of people who have nothing else.